Charmel here in Grecia, Costa Rica, with a little bit of information about health insurance. I get a lot of questions about health insurance from people who also are interested in retiring in Costa Rica. So again, I am not an insurance agent or an attorney or a travel agent or a relocation specialist. I'm not offering any webinars or retreats or consultation, any sort of consultation. I'm not selling anything. I am just sharing what I have learned through many conversations with other Americans and Canadians who have moved to Costa Rica, retired in Costa Rica, consulting some websites, consulting some other people. So I'm just sharing my experiences from the perspective of a grandmother in her late 60s who's living on Social Security, living on a budget, and moved to Costa Rica to retire. So I hope you can hear this okay. I'm at the outdoor yoga gathering place, and there's a fountain, and if that gets to be too much, I'll start over and turn the fountain off. Everything in Costa Rica is outdoors because of the perfect climate. So to me, health insurance is very related to residency. It gets complicated and confusing. We're going to take this in little 5-minute segments, and today we're just going to talk about some very basic things because it is confusing, confusicating, as they would say in the movie Wicked. So when you come to Costa Rica, you can't just come here and say, hey, I live here now. You enter as a tourist with a passport, of course, that's what I did, and you have to have a return ticket because as a tourist, until you have residency, you have to leave every 180 days. It used to be 90, and now it's 180, and you cannot move here and take the job of a native Costa Rican. So whenever I enter the country with my airline ticket, the person at the passport station wants to know when I am leaving. So you have to leave every 180 days. A lot of people just fly back to the States and they use their Medicare, go to their doctor's appointments, and a lot of people live here for years, even decades, without ever establishing even temporary residency. And you can do that, but you still have to leave every 180 days. You don't have to fly back to the United States or Canada. You can just cross the border and have lunch in Nicaragua or Panama, get your passport stamped, and then go back. But there's also the concern that one day maybe they're not going to let you come back. So a lot of people take the steps to establish residency, and the initial step is temporary residency. Even if eventually you decide to have a visa that is for pensioners or for nomads who work digitally from home, and there are many of those, the first step is temporary residency, which will lead to permanent residency. And with that temporary residency, there are some pros and cons. You get a driver's license, you can have a number, a file number indicating that you have applied for temporary residency, which means that you don't have to leave the country every 180 days. You get some discounts, like if you're a senior citizen, you get to ride the bus free, but the bus, like for me to go into downtown Grecia, is like less than $1, so that's not a big plus. But the health insurance, which is called CAGA, C-A-G-A, nobody remembers what that stands for, but it is their public Social Security and universal health care system. So once you get temporary residency status, you have to pay into the CAGA system, which is like 8 to 11% of your income, your Social Security income. So you don't have a choice about that. So some people think that's good, some people think that's not so good, and we're going to explore that in the next little 5-minute video about the CAHA Universal Health Care System. You can Google it and learn quite a bit, but I'm just going to explain to you what I have learned from talking to people who have moved here to Costa Rica and retired here in Costa Rica. So that's all for today. Pura vida, adios. I'm going to meet a friend of mine, Debbie, from the United States in a nearby town of Sarchi. And so see you later in the next video. Bye. Adios.